Thank you. Thank you so much. You allow me to stand. I stand for Madiba. And when he walked out of prison, he raised his fist and he said, Amandla! Awetu. We answer Awetu. Amandla! Power to the people. He was not only getting out of prison, but today I reach out to the spirit of Madiba for us to get out of the prison of poverty, to dare to be courageous and to dare to be candid, to dare to walk the long path and knowing that that path is not easy. In the time that I have, and with an amazing panelist colleagues that I have, I want to share a couple of points. First is when you are invited into somebody's compound, as we say in my village, you honor and respect. So I want really to thank you for inviting me, inviting the YWCA, YMCA movement, inviting us with my brother, inviting my sister Amina, UNICEF, and other colleagues. Because it's an act of generosity to dare to listen to other perspectives. And for us, that is where the notion of transformation starts from. It starts from listening to that other perspective on the basis of which we dare either to scale up the great things we are doing or to transform the things we are doing. Secondly, I want to share a little bit about myself. Because at times, when we stand up here as leaders, including myself, at times we forget. At times we forget that I'm the last child born of a mother who had 11 live births and 14 pregnancies. That all my life as a young girl, Zimbabwe was at war. That I did not go to school for 3 years because there was no school to go to, but also there was no school fees. That I wanted to know where the bus comes from. I would see the bus come in the morning, pass through my village. I had my yellow dress with red buttons. That was my only beautiful dress. When I had my first menses, I didn't even have a decent underwear to use. Neither did I even have that basic. Now we talk about pads. What brand do you use? I didn't even have that piece of cloth. So at times, we forget. And when today I am in this conversation as a global leader, leading our amazing YWCA movement, 120 countries we are present, 25 million women and girls who volunteer every day to change their lives and change communities. I ask myself and say, am I that village girl? Am I that only child who managed to go to high school, to university, when my own sister had to be married in order for me to go to school? Not exactly. When we're talking about these things, it's about us. An amazing Norwegian who is in this room said to me, I'm sending your name to Mr. Ban Ki-moon for the UN Women position. And I said, my sister, I am a village girl. Yes, I've worked in the United Nations for 10 years. Yes, I'm leading a global movement. I have never been a minister. I've never held a political position. And you know what she said? She said, we have to redefine leadership because leadership is not just political, it's about being a leader. So I just want to thank you for affirming young women like me, and which is my perspective today. I want to share around investing in young people for the present and for the future. I'm sharing this in the full understanding that my movement, the YWCA, YMCA movement, is very present in this country for over 100 years. We have over 300,000 members in this country. So I'm also speaking from the voice of the local, the internal, the national, and celebrating many of you. I'm also speaking from the perspective of the many years of work and partnership that we've had from a civil society point of view, working closely with the Norwegian Church Aid, working closely in many spaces with Focus. I'm also speaking from the notion where you have given me amazing generosity in the last 10 years of my life as a professional, as a human rights lawyer, as a UN official, where you invited me to be part of your 1325 policy. When you are developing your national action plan on 1325, I'm raising this because this afternoon I want to connect the dots. To connect the dots of policy in this country in relation to the issue of education and health. 1325, Resolution 1325, you have a national action plan in this country, and you have been leading in the discussion. That, for us, is part of what should shape the response to health and education in responding to Syria, to Central African Republic, to the Democratic Republic of Congo. It has to be the blueprint within which we engage in the conflict-related humanitarian settings. You again invited me to be part of the conversation on the gender policy a couple of years back. And I was thrilled to be in your parliament. And so in connecting the dots around education and health in our discussion, what we do as the YWCA, echoing the ways that Amina Mohammed said this morning, how do we engage with other institutions, including the oversight role of parliament, as they not only define legislation, but equally define expenditure. The third invitation that I had was to your seminar, your conference around global health and human security. And you invited me, and I was here when we said goodbye to Sigrid Mogadal, one of the amazing women in this country. And today to listen to Mette Marit and to Terry Godal, whom I served with in the commission, was amazing. So I'm connecting the Norwegian policy spaces that I've been involved with my work every day, with the millions of women that I work with. Couple of stories. First is Mereso. Mereso is rural Arusha, married at age 14 to a 70-year-old, pulled out of school. By age 29, she has 5 children. So when you connect the issue of culture, reproductive health, education, early marriage, and potential for the regeneration of a household, that is what we are talking about. We are talking about Maria Ziwenge from my country. She was born with HIV. Her parents died when she was very young. She could not complete school. She has a baby. She needs medicine. She's a cross-border trader. She goes to South Africa and Botswana and everywhere to look for food to raise for her family. But Zimbabwe is not poor, which is my second point. Thirdly, as we have this discussion, looking into the work we do every day as the YWCA in the area of education, the YWCA movement globally is involved in early childhood education, is involved in vocational training, non-formal education, and we run schools like in Bangladesh. And we have a university, and we founded university like the Iwa Women's University in Korea. So the YWCA movement is in the spectrum of the formal and the non-formal, and that is one key point that I want to emphasize, that education needs to include non-formal education, life skills, and learning outside of the classroom, especially for young people who may have dropped out of school. We need to say what are the other education opportunities. In the area of health, the YWCA movement across the world is so significantly involved in responding to HIV for the last 20 years. And currently, a very strong work around reproductive, sexual and reproductive health and rights and HIV. And we need to discuss the issues of sexual and reproductive health and rights for young people in the relation to education, because that is the age cohort when we see dropouts, especially for girls, because either of teenage pregnancies, either of early marriage, or many other issues that come into the front. That is part of the work that we are doing in addition to responding to issues like cancer prevention programs, disability-related programs. I go back to the personal narrative back again and say, we have lived with HIV in my family, and with mental health in my family. And at times we forget the non-communicable diseases. At times we forget the impact that it has on the health of the whole family and the opportunities for the whole community. What we need to do around accelerating MDGs now and into the future within the time that I have left. First, I think we need to ask the difficult questions. Maybe it's because the Mandela moment in me. We have to ask the difficult questions at this moment. I think the first important question is, really, we need to talk about the politics of development. Africa is rich, and yet the statistic of Africa and the narrative of Africa is my death, my poverty, my illiteracy. How do we have that prosperous Africa which is at peace with itself? That's the question. How can Zimbabwe with its diamonds and gold, how can DRC, how can... I find this disconnect between being very rich and living in extreme poverty, that women can barely lick the spoon and they don't own that spoon. So that's, for me, the fundamental question. The second fundamental question, which links with health and education, is the whole discourse of we need to eradicate extreme poverty. I just want all poverty to go away, not just extreme poverty, because we are already accepting that some people must continue to live in poverty. I think the $2 a day is an economic indicator, but I sold bananas, got $2 home, and we could barely survive. $2 a day. I think there's something which does not make sense to me. We need to shift language. The language of trickle down is a language of minimalistic intervention. Communities need showers of resources. They don't need trickles of resources. The NGOs, the communities who are hard on the ground need to be trusted with quality resources to enable them to scale up innovations in health and education. Hard to reach from whose perspective? When I was in the village and people said it's very difficult to reach you, I'm saying, but we are walking every day to access his hospital. We are walking every day to go to the grinding mill. So hard, is it our own comfort? Are we as development workers using this term in order to hesitate to go the extra mile? Let's shift the narrative a little bit and say it's possible to reach everybody everywhere if we have the political will and the means to do so. Lastly, my last two recommendations. In the work that we are doing together, with the support that you are providing us in the area of education and in the area of health, there are three things that are very clear to us and which is part of why we are very, very excited. The first is we need intergenerational approaches. It's very clear that the present and the future is female and is young. The demographics are telling. We cannot pretend that we don't have the youth bulge and we don't have more women. Therefore, the investment in education and health needs to go with that reality of human resource development for us to have the transformation that we are looking for. Secondly, we need to have the courage to discuss the most difficult issues. Why is it easy for our parliaments and our governments to approve a military budget and buy more helicopters when every day we have to struggle to get expenditure for health and education. We need to say real security is when we have money for health and education, and not more guns and more helicopters and more drones. That is not security. Real security, real ending development is when we invest in health and education. That, for us, is very important because we are tired as women volunteers in the communities, ducking the helicopters whilst we are running to a hospital in a tent. We just need the war to end, for hospitals and schools to be functioning, and for that reduction in military expenditure to go to health and education. Third, we need to have the courage to have crucial conversation around culture, faith, and rights. We know that so often women drop out of school, get married, and all range of other issues because of issues of the contradictions that at times are highlighted around culture, faith, and rights. My culture and my faith must affirm my rights. It's very important that we continue to assert the positive aspects of culture and faith, but we should continue to find ways of saying it's unacceptable for us to justify the violation of the rights of women and girls to education, to health services, under the altar of faith and culture. My culture, my faith affirms my rights, and we need that coherence in that discussion. I really appreciate Norway's courage to support us in terms of creating space for crucial conversations with faith leaders, with traditional leaders, for us to assert faith rights in education. And lastly, change is when each one of us dares to do things differently. Each one of us. When we talk about political will, at times I say, it's not out there, it's you and me actually. It's you and me who have to do things differently. So thank you for enabling this village girl to be a leader.
Oops, let me hold it.